Hello and welcome to yet another information packed session on behalf of Apollo Hospitals, your trusted healthcare partner. I'm your host, Gaurav Thakral, and today we will talk about the most important topic of H3N2 virus. To enlighten us on this topic, I'm delighted to have with us today Dr. Rajesh Chawla, Senior Consultant Pulmonology at Indraprastha Apollo Hospitals, New Delhi. Dr. Chawla is one of the most sought after pulmonologists in India with more than 3 decades of experience in respiratory medicine, critical care, and sleep medicine. Dr. Chawla, over the years, have successfully treated thousands of critical care and respiratory distress patients and is involved with patients needing lungs transplant at Apollo hospitals. Sir is an active member of many professional medical associations worldwide and had presided over the prestigious Indian Society of Critical Care Medicine. The session will also be available in the form of podcast by the name of Hello Apollo on Spotify, iTunes, Google Podcasts, and Amazon Music. I thank our viewers and listeners for tuning in and making us grow in such large numbers. Once again, I welcome our very own Dr. Rajesh Chawla to our live session and podcast.
Thank you.
Doctor, we have few questions today which are trending nowadays. We are hearing a lot about the latest scare in town, that is H3N2 virus. What is H3N2 virus and how can we identify that an individual is suffering with this infection? Should we be scared about this infection?
See, like influenza virus or like any other flu virus, this is a subtype of influenza A virus, which causes flu, and the it is other name for this is also the Hong Kong flu, and it has caused many epidemics, but hasn't caused any pandemic. But this is previously used to occur in the birds, and then it has now been seen in human beings, and majority of it is seen on the change of season. This is the time when you start seeing this virus, and every year uh, few of these patients, because this spreads like wildfire when it occurs, the families get affected, and then oh, a very few percentage of these patients do land up in hospital requiring oxygen, and out of that very few get into the ICU requiring the respiratory support.
Doctor, how does this infection spread? How can we differentiate it from the common cold?
You see, most of the symptoms would be like common cold. Every year, most of these viruses, when the new strain develops because of the antigenic shift or antigenic drift, when there occurs, there is a new strains which comes up, and new strains has a different set of symptoms. But majority of them will have a flu-like symptoms: the nasal discharge, body ache, headache, fever for a short duration. Like H3N2 this year has a fever for 2 to 3 days maximum, and body aches. Sore throat is also very predominant symptom in most of the individual. And the one symptom which I think you must have come across a lot of people is a continuous cough, which is the most distressing. And very few patients feel difficulty in breathing also, particularly patients who are suffering from respiratory illnesses like जिनको दमा है या COPD है, उन patients को they can have increase in their breathlessness, and many of these हॉस्पिटल में भी आ सकते हैं, उनको acute attack आ सकता है. बट मेजॉरिटी का मतलब मेरा ये है कि 100 में से 90 लोगों को बड़े माइल्ड सिम्टम्स होंगे, and out of that few will have no symptoms. These are the individuals who spread the virus, whether it was COVID, whether it is influenza, whether it is a common flu. People who do not get symptoms, whose immunity is good, they do not get symptoms, but they spread the virus. So it is not much different from the common flu. It will have a flu-like symptoms, but this year it has a more symptoms, which are the persistent cough, and quite a good number of patients, they are having the cough for 3 to 4 weeks, and many of them requiring the bronchodilator drugs, which we give for asthma. And it is not that they are going to be on this, but some of these are requiring this year.
Dr. Saab, how is it different from COVID 19? Would this also need RT-PCR testing? Or is there any vaccination for H3N2 virus that can prevent us from the infection?
You see, it is definitely different from the COVID-19. COVID-19 is a coronavirus. It is the influenza virus. So there is a difference. First of all, the quality, the type of virus is different. The symptom COVID-19, the different mutant had a different symptoms, and but majority of them also people were asymptomatic, people were symptomatic, and the mainly the flu-like symptoms, and the many of these patients have a tendency to drop oxygen. You know what we are finding after the vaccination of COVID-19, particularly people who have vaccinated themselves with all the 3 doses, they are not having much symptoms. And in fact, recently we had a patient of COVID-19 got admitted. He was the one who did not take vaccine. So I again recommend that people who have not vaccinated yourself, please get your booster dose. And if you're not vaccinated yourself, please start your vaccination, because this is the only way you can protect yourself and protect others from spreading, by getting yourself vaccinated. As far as the vaccine you were asking about, the H3N2, first let me come to how is it diagnosed. See, diagnosed is, some of the places and the National Institute, they come out when there is a epidemic like this, that what virus is prevalent, like this time it is H3N2. And if people are getting symptoms, you know that most of the times they will be H3N2. And for mild symptoms, people don't intend to get it tested, fairly enough. But if you really want to get it tested, then RT-PCR is a test. Like in Indraprastha Apollo Hospital, we have RT-PCR, which we do for H1N1. It also includes H3N2. So RT-PCR molecular-based test is again the way to test any virus, whether it was COVID-19, whether it's H1N1 or H3N2, it is RT-PCR, which is available in many of the centers, and also in the Indraprastha Apollo, I know that it is definitely available there. As far as the vaccination, you said, of course, there is a vaccine, influenza vaccine, which is available in different brands by different companies. And nowadays, they are quadrivalent vaccines. Quadra word is associated. I will not name the company name, but they are quadra. Quadra means it has 4 types of virus: 2 influenza A, 2 influenza B. Out of that, H3N2 is also included. Now, what is the advantage of these vaccine? Vaccine, comes before this strain had appeared. But once you are vaccinated, it still prevents you from getting the severe illness. So it is important that everybody any adult from 2 years onwards can get this vaccine without any problem. But if vaccine is not available, then probably it is recommended that people above 65 years of age and people with chronic respiratory illness, chronic renal problems, chronic heart problems, immunodeficiencies, malignancy, post-transplant, these are given priorities, like we gave priorities in COVID-19. But anybody can get an influenza vaccine, and it has to be repeated every year because the immunity weans off. So you should take influenza vaccine, particularly if you are suffering from any illness. At least you will prevent the severe form of this disease. And this is the only preventive measure which is definitely found to be effective in a lot of clinical studies.
Dr. Saab, if a person is suspected to have H3N2 infection, what precautions he or she must take? Are there any home remedies? At what stage they must contact the medical specialists?
See, I think the first is what you're trying to ask is how to treat this. See, take a lot of fluids. If you have a viral infection, take good amount of fluids. Rest. Always remember the best remedy for any viral infection is the rest. People tend to work, people tend to show that they're very strong, but it takes longer for viral infection to get. So rest is very important. Rest doesn't mean going on WhatsApp and going on a Facebook. Rest means rest. That you rest from all this and sleep well. Take a good sleep, because all these things will increase your immunity to fight infections. Take good, normal, balanced diet. That is enough. If you have a fever, take paracetamol. If you have a nasal discharge, take antihistaminic. If your cough is persistent, then you can take a physician help, and he can prescribe you bronchodilators. Maybe if he needs some inhalers can also be given. Antibiotics have absolutely no role in the management of this. Azithromycin has been misused like candies, which is absolutely not required. You don't require antibiotics. Just this 90% of the patient can get better with this. And precaution is for yourself, precaution for others. So you must wear mask. If you come in contact with another person, you must wear mask, and preferably the other person also should wear mask, because this spreads very fast in families, because people don't isolate themselves. They're eating with the family, they're sitting with family, and then the whole house is having sneezing and cough from every room. This is because a person who had the first symptom, he should, if there is a possibility of isolating, if there is a space in the house, if you can isolate, please isolate yourself. It is just a matter of 3-4 days. And if you anyway have to interact with others, wear mask. Because by wearing a good mask, you can prevent the spread to others. And you really don't know who will get a severe disease. It all depends on your genetics, immunity, and lot many other factors. So it is important that you not only protect others, you also protect others from getting a severe illness. So you're doing sort of social service as well. So this is the precaution you should do if you get symptoms like this. Not only this H3N2, any kind of flu you get, any kind of symptoms, now it has become important in 2023 to wear masks to prevent the spread of these viral infections to others.
Dr. Saab, is there any vulnerability with respect to age?
Yes, the very old, above 65, and young adults below 2, they're more prone to serious illness. So they need to be even more careful. And if they venture out, then they should try not to venture out when there is a seasonal flu everywhere. Don't go to malls, don't go to places which you can avoid. Marriages, wherever you can avoid, you should not go to these places, because chances of getting बहुत ज़्यादा है. सो ये आप पे डिपेंड करता है कि आप और जाते हैं तो मास्क डालिए, because now it has become a norm. Nobody is going to consider it as a taboo or something. So you wear mask, it is okay. People consider it is fine, and some people you will find appreciate you also, that you are taking good care of yourself. So I think these are very, very important things one should. And any person who has a viral infection, hand hygiene, social distancing, wear mask. These are very, very, and if you cough, you should cough like this. Don't cough in the public like this, because you will spread. This is the way that when you cough, nothing will go, because this infection spread by droplets, as I said. When you come in contact with another person, when you talk, you must have seen when the sun is coming into a room, everybody is producing a lot of droplets. And these droplets, when they are inhaled by another person, that's how the person gets infection. So it is important that hand hygiene, social distancing, wear mask, and be a responsible citizen, not to allow this viral to spread to others.
Dr. Saab, does the seasonal change have any impact on the outburst or spread of H3N2 virus infection?
Some of the virus thrive in a particular kind of environment, and the development of a new strain. So all these combination, usually at the change of season, this occurs more often. So the winter is setting in, summer is setting in, and you are getting H3N2. Similarly, when the winter is setting in, you get another virus. So these are the times when the this seasonal flu is more.
Dr. Saab, is there any scare to life with the H3N2 virus infection? We have heard some news recently about
Because
some
media has spread a lot of news. I mean, there is one odd person. This is not a new thing. Every year we get patients with influenza A virus in the ICU. Otherwise, also some of the patients of any infection will get serious. So it is not because this has been in the media after COVID. Anything spreads very fast. There have been deaths reported. Only 2 or 3 deaths have been reported, and some patients have come to the ICU, but majority of the patients had a very mild illness. Majority, I mean to say more than 95% of patients have a simple flu-like. So not to scare, be cautious, and you can, if you have an oximeter, you can see your oxygen. If your oxygen is all right, you're not breathless, and you have symptoms which can be easily tackled, then there's nothing to worry about.
डॉक्टर साहब, नाउ लीडिंग दिस कॉन्वर्सेशन टू एन एंड, आप हमारे व्यूअर्स और लिसनर्स को क्या मैसेज देना चाहेंगे?
सबसे पहले तो मैं यही कहना चाहूँगा कि अब हम उस इरा में रह रहे हैं जहाँ ये इन्फेक्शन होते रहेंगे। हमें इसमें रहने की आदत डालनी है, अपनी आदतें सुधारनी है। हाथ धोना सबसे पहली आदत है। खाने से पहले, कहीं जाने से पहले, किसी के कांटेक्ट में कुछ टच करने से हाथ धोने की आदतें अपने जीवन में ढाल लीजिए। वायरल इन्फेक्शन से भी बचेंगे और चीज़ों से भी बचेंगे। दैट्स नंबर 1। नंबर 2, जब भी कोई सीजनल फ्लू या कोई भी इन्फेक्शन हो, फालतू का बाजार में, मॉल्स में इधर उधर मत जाए, बिकॉज आपको पता है ये थोड़े दिन का है, ढल जाएगा फिर चलेगा। सो अवॉइड ऑल दैट। इफ यू हैव गॉट इट, अगर आपको हो गया तो हैंड हाइजीन तो आपको करनी है, मास्क डालना है, दूसरों की बचत करनी है, सोशल डिस्टेंसिंग करनी है, फालतू में जैसे कहीं नहीं जाना, कोई आता है तो उससे कुछ फीट की दूरी पे, 6-7 फीट की दूरी पे आपको खड़े होना है। ये सबसे, और H3N2 से डरने की जरूरत नहीं है। मेजॉरिटी में बिल्कुल माइल्ड इलनेस है। अगर आपको होता है तो सिंपल होम रेमेडीज, पैरासीटामोल, एंटीहिस्टामिनिक्स आर एनफ। If the symptoms are more, then you can of course take a help of a doctor. He can prescribe you based on your symptom and examination. और ज़रूरत समझेंगे तो टेस्ट भी करा सकते हैं। इसके लिए RT-PCR is the test which is done and which can diagnose. Very few patients land in the hospital, and very few out of that will go into the ICU. So don't get scared, but take care of yourself so that you can have a healthy and without getting disturbed kind of a life. Thank you.
Thank you so much, Dr. Rajesh, for joining us for this conversation and uplifting us with this encouraging message.
Thank you very much.
To our listeners and viewers, if you need any professional help, you can reach out to us through the details mentioned below or through our social media handles. To know more about healthcare and our upcoming episodes, do follow, subscribe, and share this message to your family, friends, and loved ones. We will be back with another specialist discussing another interesting topic next week. For any suggestion regarding the topic discussed today, message us on our social media handle Apollo Hospitals Delhi. We'll be happy to connect. Till then, stay happy and healthy. Thank you. This is your host, Gaurav Thakral, signing off.